name is Faith Selchick. I am currently the regional director of cancer services for Westchester Medical Center. So I am over the Western region, which includes 3 hospitals. Prior to being in administration, I worked as an oncology nurse practitioner. I worked in various specialties. I started my career in phase 1 clinical trials at Yale, which was really eye-opening to see, patients who had failed other therapies and were on last-ditch efforts. A lot of those drugs we're using now regularly, like Keytruda, that we were trialing back then. Then I moved into the gynecologic oncology space, and I saw cancer from a different perspective. And then I came here to Westchester, where I started as an oncology nurse practitioner in medical oncology. So I got to see cancer across the scope. I saw all types of cancers, all types of treatments before moving into administration. But initially, I was an oncology nurse, so I was an inpatient nurse at Duke, where I went to school, which was a whole nother layer of oncology again, because we saw a lot of really sick patients, end of life, palliative care, and I didn't realize that people could live and thrive through cancer treatment, which is what I learned when I got my first outpatient chemotherapy position, as a nurse and saw people, coming in, having lives and families and careers and treating cancer as a chronic disease. So I feel like I've seen cancer from so many different lenses, and that really helps me in my current role because I always said whenever I got to a position where I could impact change on a higher level, I was going to take everything that I learned in the trenches as a nurse, as a practitioner, and use that. And I leveraged that in every single meeting, every single decision I have to make. That's at the front of it because when you're at the front lines, that's where you really get to know the patients and what matters to them. I'm so deeply honored to even be named a finalist for this care award. Oncology is my passion. It is, a huge part of my life. It infiltrates my personal life and not necessarily in a bad way. Because I'm constantly asked the question, how do you do this? How do you stay positive? And for me, I know that we can't always change the outcome, but we have control over the journey, right? And so that is really my motto when it comes to oncology care, and all of my staff and my nurses understand that because that's at the heart of things. So I'm just proud to represent a field where like empathy, advocacy, innovation, they all intersect every day and they improve the lives of patients and their families and their caregivers when they're facing the worst time in their lives. So being acknowledged for this is just humbling and motivating, and I'm just dedicated to advancing high quality oncology care in any sort of landscape that I'm in. So I just appreciate this, and for the patients and communities that we serve. It's more than just being recognized, right? It's kind of like a culmination of things. It's like somebody, people see that you're so passionate about this and the mission of this. So it's motivating, right? And it's inspiring regardless of the outcome because I really do care about this. And it's just like the core of my life is oncology care and making it better for as long as I can.